Dr. B. Fafumi. Sorry, Dr. Fafumi, for referring to you as Mr. earlier until Shola referred to you as Doctor. It was what I was given. But Dr. Fafumi, it is thought that this is a delicate kind of study. I don't know why, when I said delicate, you could also use the word sensitive, because maybe the subject matter that we're dealing with, it's not exactly what people aspire to. Yet here you are, you have to study it and come up with what we are talking about right now, a graphic representation of the multidimensional poverty in a country, in this case, in our country. How difficult or challenging, or indeed easy, was this particular exercise? As I said, I hear that you've been working on this for the past 2 years. So how challenging has it been? Or is it really in the ordinary run-of-the-mill of statistical operations?
Okay, thank you very much. But before I answer that question, let me go back to the question that was thrown to Shola. And again, please, point of correction, I'm not doctor, I'm Mr. B.
I'm sorry. So I took her correction without double checking it. My bad.
Yes.
Okay, so it's B. Fafumi. Okay.
B. Fafumi. So
Shola, I hope you heard that. Please continue.
The issue of sample size and sample design.
Yes.
So the sample was designed to be representative enough because it covers the entire 109 senatorial districts in the country, and this is also taking into consideration of all the 36 states and the FCT. So in each of these senatorial districts, 34 enumeration areas were selected per senatorial district, giving a total of 3,774 enumeration areas. And again, the sample design was in 2 stages, because after do the selection at the senatorial level and the EA level, then 15 households were selected in each of the EA, making a total of 1,530 households per state. And that will give us a total of 56,610 households nationwide. So you can see that the coverage is very, very big enough, and it's one of our biggest sample size that
it is. The only problem I, as an individual, still have, though, is wrapping my mind around the 0.257 figure that you gave earlier. It's not as easy as if we're talking about census, which is another statistical kind of an exercise. You come up with a figure like 32 million. 344 million. So it's clear what that means. But I think you gave me the understanding that a figure of 0.257, for example, as the MPI for the country, I don't know how it lasts. You gave me to understand that what this means is that
you know there is a difference between the poverty index and poverty incidence. So the poverty index is 62.9%.
The poverty index is
62.9.
62.9, almost 63. Almost 63.
Almost 63. So,
that would be the MPI for Nigeria. I'm trying to understand this.
The incidence of poverty. So that is the incidence of poverty, which means 62%. You understand? 62.9 or 63%. So now going back to
does that mean sorry sir, does that mean that 63% of us are multidimensionally poor?
No, what we mean is that if you want to now know the number of people in Nigeria that are poor, that would be 129.47 million Nigerians that are multidimensionally poor.
Which makes up a percentage of how many of us?
Now?
What is that
Yeah.
percentage?
So that's now 20. That is 62.9%.
Okay.
Because Nigerian population is around 200 and something
Yes.
million.
Yes.
Yeah.
Okay.
So you understand now?
Well, you know, I'm sure by the time this is released, I'll understand it even more because it'll be presented and there'll be papers and one will be able to understand it a bit even more. But thank you very much for your efforts in trying to get me to understand it. But looking at, I asked you, you know, how sensitive or not it is, because people seem to have that notion. Is it because it's presenting unglamorous statistics? Is that why? That nobody wants to be among, you know, the statistics that are thought to be unglamorous?
Well, you know, statistics is a fact. And people are running away from fact. And that is the difference between MBS and any, we can't run away from the fact that is the situation on ground. And it's what we receive from the household or even if it is establishment that we analyze and give to the country. And at times, when we release the data, some people will say, oh, MBS, you are doing well. To the other side, they might say that, oh, MBS, upon all what we are doing, you are still releasing this type of data. So it's both sides. So some see it as, yes, this is the situation. Some see it as, oh,
it is what it is. Yeah, it is what it is. You know. Okay. Coming back to you, Shola, would you let me take your comment on this aspect of it? If you want, you see, I think one of the good book says the poor we will always have with us. So throughout the history of mankind, there has also always been poverty, but you guys are now being more scientific about it. So you're now talking about a multi-dimensional poverty index. But relate to that whole matter about, you know, people, how sensitive it is. It's like when you say Nigeria is 250 million, I can say, yeah, you know, and I'm one of those. I'm one of that 250 something million. But when you bring up things like not just poverty, but the multiple dimensional aspect of poverty, and you come up with a figure, you know, I wouldn't be surprised if not too many people wanted to raise their hand and say, yeah, for this side of our country, I'm one of them. You know, so is it difficult? Do you think, is it psychologically difficult? I was.
Okay, thank you for that. So interestingly, not just the data that we captured, we also had interviews that were conducted on the field, and people were not shy to talk about the way they are deprived. You know, for the first time, we're looking at, you know, measuring, making people, even they themselves, understand that they are poor if you are deprived in, you know, for instance, within health indicator, we have a question that we ask them. What is the distance between your house and the nearest community healthcare center or hospital? And they are willing to say, because, you know, people don't want to be identified or stigmatized. But however, they are willing to say, oh, this is what it is. And so it wasn't difficult at all for people to,
I can understand,
and tell us the kind of poverty. Yeah.
Well, I can understand when you put it like that, people weren't shy to tell you some of the answers to these basic statistical questions. How far away from, you know, a community health center are you? But because we're talking about education, well, monetary policy number one, you know, even though you guys are explaining that it goes beyond that, but you think of poverty, you think of a lack of money, but you're saying beyond that, it also could be a lack of, because we're talking about dimensions of well-being, of which money is just one, as you've explained. So you seem to be giving me to understand, Shola, that people were quite comfortable talking about whatever their truth is. whatever their truth is, it appears to me that it will be hard for you to understand what we're talking about, thinking about maybe embarrassment of people not wanting. No, people are actively contributing to this. I understand. Is that what you're saying? Okay. Can you hear me, Shola?
Yeah, so if I'm not sure I did hear you, it's not so clear. But if I were just to buttress my earlier point, for instance, those that are living in riverine area that we did interview, and they've not seen electricity in the past 13 years. Even though when we asked them in terms of food and nutritious food, they did score high. But in terms of electricity, so they MBS is very good at what they do in terms of being able to elicit the kind of information, to get the kind of information, and making people comfortable in sharing actual data with us. So it was they asking, in the daily lives and how they do their business, how they, live in their livelihoods and stuff. So they were able to take us through that process, and then we're able to capture in a scientific, statistical manner.
Sure. Coming back to, Mr. B. Fafumi, coming back to you, B. The whole question, does it mean that when the results of your work in the past couple of years is released, I shall be able to grab hold of the document and say that, let me find out the poorest state in Nigeria, for instance, and who is the second most poor, and who is the least poor. I know that might not be your original, your most important intention of it. It's probably more for policy, developmental issues. But indeed, will that document provide that kind of information so that we could see that, well, on what World Bank and UNDP and all these people and the statisticians are calling MPI, Multi-Dimensional Poverty Index, I can now see that state X is actually, going by these parameters, the poorest state in the country. Yeah.
Hello?
Yes. I'm
please,
done.
I didn't hear you clearly, please.
When this information is released, when this study, when this survey is released, will I be able to grab hold of that document and see from it what is the poorest state in the country in terms of, the academic properly statistical nomenclature of multi-dimensional poverty index? Will I be able to see the country, the state that has the biggest case of that, and the state that has the least indication of that?
Yeah, I think part of our MBS data production process is dissemination. We don't take that lightly, and that is why we have a data dissemination policy whereby we release not only the aggregated data that you can even see state by state or senatorial district by senatorial district, but we also disseminate the micro level data. And if you remember, Sola also mentioned that part of the launching on Thursday is the poverty lab in MBS, where people can access the result of this survey, and you can also do some analysis or comparison
of your own,
even in maps, so that you can look at state A versus state B and see how each of the states is faring in terms of multidimensional poverty, and even other data available that's related to poverty in Nigeria.
That's going to be very, very interesting. I'm afraid we've run out of time now, but I want to thank you very much, Mr. B. Fafumi, Director, Information and Communications Technology